My name is Patrick Greene, and I'm the Director of Pharmacy Operations at GenoPATH. So I'm actually a clinical pharmacist who specializes in the application of pharmacogenomics. I've been working at GenoPATH for about 2 years now, and I lead the clinical pharmacy team that are focused on applying the principles of pharmacogenomics and evidence-based medicine to improve patient care. The process of actually creating a MyPath medication review for our patients is really a multi-step. So it starts when we receive demographic and medication information from the clinic, and it's very important that we receive the most accurate, up-to-date medication list for that patient. Because like with any clinical product, if you receive good information on the input, you'll be able to produce a quality report. Once we receive that medication information, we compare it to both genetic factors that we learn from their lab results, and we also apply certain extrinsic criteria such as the Beers list and the stop-start criteria to ensure that, for example, for our geriatric patients, that they're on appropriate medications for their drugs and disease states. Our average patient is about 66 years old and taking 11 prescription medications. So with so many drugs on that patient's profile, the risk of severe drug-drug interactions increases exponentially. So what we do is we take the genetic results and apply those to help screen out medications that may not be tolerated well in that patient due to increased risk of adverse effects. And then we also apply some extrinsic tools. The best example of this is what's called the Beers criteria, and it's a list of medications that, based upon a patient's age, may be potentially inappropriate. That depends on a lot of things, including other diagnoses and medical history, but the important part is that we try to improve the patient's care by any means necessary, whether that's pharmacogenetic factors, Beers criteria, drug-drug interactions. We want to personalize that care to make sure that the patient has the best outcome possible.